The U.S. State Department will no longer commemorate World AIDS Day with public messaging. You're looking at photos from last year when former U.S. President Joe Biden marked the day on the White House lawn. The United States began commemorating it in 1988. The New York Times reported earlier this month that the State Department instructed employees and grantees not to use federal funding to mark World AIDS Day. That includes refraining from any communication on social media, media engagements, and speeches. However, federal employees can still attend external, locally organized events. Dr. Bogoch joins us now, an infectious disease specialist, but also started the first dedicated HIV prevention clinic in Canada, right here in Toronto, that offered HIV pre-exposure prophylaxis, now offered across this country. We were talking a little bit about this and sort of the state of the global HIV landscape. Where do we stand right now?
Globally, if we take a snapshot of where we are, we're doing a lot better than in prior decades. HIV-related deaths peaked in about 2005 and have been on a tremendous downward trajectory since then. Having said that, the future is not bright. There have been significant cuts in global funding to very important HIV programs for diagnosis, for treatment, for prevention, for destigmatization, and it's really upsetting because I think all of these tremendous gains we've made in the battle against a terrible infection might soon start to reverse if we don't step up as a global community and really fund these very important public health initiatives.
We're hearing that from a number of groups. And today, I know we're going to be having a news conference, HIV legal team framework about their recommendations for the Government of Canada to end the HIV epidemic. That is expected later on this morning. So specifically in Canada, we hear groups like this pushing for change. That must set off some alarm bells for you. And when you hear what they're asking for, what is it that you think needs to be done?
For starters, I think Canada's doing remarkably well relative to the rest of the world and also relative to other high-income countries. Like, we have very good access to medications, to treatment, to prevention programs. Listen, is it perfect? No, of course not. Nothing's perfect. But relative to our peers, we're doing remarkably well. And in fact, if you look at the data in Canada, we don't see a lot of new HIV infections acquired in Canada. It does happen. We need to do better. We absolutely have to improve our efforts. But a lot of this rise in cases in HIV that we saw in Canada might not have been acquired locally in Canada. And I think that's an important distinction to make. So, yes, are there improvements we can make in Canada? For sure. We can always improve better access to care, better access to prevention, better access to treatment, programs to help destigmatize this virus so that people feel more comfortable engaging in care. But we still have to recognize that relative to the rest of the world, we are doing much, much better.
How have things really changed in terms of what people are, able to access when they go into a clinic now in terms of testing and prevention measures, things like that? From, back when you started with all of this, I mean, as you say, we've come a long way. You say the access is good, could be better. What does that look like?
So, we like to think that Canada has a healthcare system. It doesn't. We have 10 different healthcare systems in Canada. So each province is taking a slightly different approach. Each province has slightly different funding mechanisms for treatment, for prevention, for diagnostic tests. But in general, most people who need HIV prevention care will find a way to access it. And there's a patchwork of programs that exist in the various provinces to enable care. It's a team. It's not just a physician who's going to be managing a case. You really need the help of social workers, nurses, pharmacists. It really is a team-based approach. But if you have a good team, you can provide adequate care. I think another extremely important point here, though, is many Canadians think HIV is this devastating infection, and in 2025, soon to be 2026, if you're lucky to live in a country like Canada and have access to care, people can live a long, healthy, happy, normal life with a normal life expectancy living with HIV. If they're on the appropriate medications, the virus in their body becomes what we say is undetectable, and that means they're not able to transmit HIV to other people. So not only is the person going to live a long, healthy, happy, completely normal life with a normal life expectancy, they're not going to transmit HIV to other people. So at an individual level, their health is better with access to care on medications. And at a public health level, they're not transmitting HIV to other people, so we're not seeing the spread of the infection. That's why it's so important to work on engaging communities at risk for HIV, enabling prevention services, providing easy access to diagnostics, enabling easy access to therapeutics, because it's good for the individual and it's also good for the population.
That's the situation here. But we were talking about cuts to funding from the United States for global AIDS programs. What does that mean for the reality on the ground outside of Canada? What happens when that support is pulled?
This is very, very upsetting, and we're walking into an uncertain global landscape because the U.S. had a very strong program that provided prevention, diagnostics, therapeutics in some of the most heavily impacted regions of the world, like Southern Africa. And many, not all, but many of those programs are no longer in existence, or are drying up, or are a shell of their former self. And it's really sad because there has been tremendous progress since 2005 in terms of reducing rates of new infections per year, reducing the rate of deaths related to HIV per year, and it's a result of these programs. So, you know, each country will do what each country does, but I think the rest of the world has to step up and fill in those very significant gaps that exist now if we want to continue this progress. Let's just be clear. We have the tools in 2025 such that we don't need to accept any new infections with HIV. We can effectively prevent it with the tools that we have. We can effectively treat it with the tools that we have. There's no reason for anyone to get this infection or die from this infection in the planet in the 2025 calendar year. We have the right tools to do so. The key is, do we have the political will to get those tools to the rest of the world, and of course to every Canadian? And in Canada, yes, we're doing rather well, but from a global perspective, sadly, I think we're going to see some reversal of the significant progress that we've had.
So then how important is it then for other countries to kind of step into that void to maybe lessen the amount of reversal that we're going to see with the absence of this funding?
Massive, absolutely massive. But, you know, when one country just pulls the plug on this rapidly, it's not like every country can just spring in and provide immediate funding to various programs. The world, unfortunately, doesn't work that way. And, you know, in a perfect world, the United States and other large global funders would continue to fund these programs. And certainly, if they choose not to, at least have an off-ramp with an appropriate duration of time so that other countries could appropriately step in and fund those very, very important programs.
It's an important topic. I know it's one that's close to your heart, and at least every time this year we get a chance to kind of reflect on what has happened with the HIV/AIDS disease and where we stand. And it's a really important topic to keep on the agenda. Thanks very much for being here with us today. As always, Dr. Isaac Bogoch, infectious disease specialist.
Thank you.